Okay, hi, I'm doing my project on pancreatitis, so we're going to do a little bit of a background first. So a pancreas is the gland that's located right behind the stomach, and it aids in digestion by secreting digestive enzymes into the small intestine via the pancreatic duct, and it also releases hormones like insulin and glucagon. Which are also essential. So what pancreatitis is it's essentially the inflammation of the pancreas. And the causes usually are something like gallstones, heavy alcohol use, genetic disorders, and certain medications. There's other causes as well, but these are the most common. There's two types of pancreatitis. There's acute pancreatitis, which usually occurs suddenly. It is most commonly caused by the blocking of the pancreatic duct by gallstones. And so kind of how that works is the bile duct and the pancreatic duct are very close together. And so if you get gallstones in one, it can essentially block the other one as well. Some symptoms of acute pancreatitis are severe pain in the upper abdomen around this general area that radiates towards the back. You also get some nausea and vomiting, a fever, and rapid heart rate. The treatment for acute pancreatitis is typically a hospital stay where you would get IV medications for fluids, IV fluids. You would also get medications like antibiotics and then pain treatment medications as well. And acute pancreatitis typically lasts only a few days, and so after the treatment in the hospital, you should be okay. Now, there are more severe cases of acute pancreatitis where you would possibly need intervention like a gallbladder removal, but the most common is typically resolved within a few days. Now, the more serious pancreatitis is chronic pancreatitis. This does not heal and it gets worse over time and can cause permanent damage. The most common cause of chronic pancreatitis is heavy alcohol use. And then the symptoms are severe abdominal pain, nausea, vomiting, diarrhea. And then with chronic, you would also get increased blood sugars because, as previously mentioned, the pancreas also secretes the hormones insulin and glucagon. And so if it's affected, then it can't regulate the blood sugars as well. And so you usually end up with hyperglycemia. There's also unattended weight loss, and then possible jaundice, and greasy, oily stools is a very common marker for pancreatitis. And the reason for that being is that if the pancreas isn't working as well as it should be, it cannot aid in the digestion of the foods. And so if you're especially eating fatty foods or something like that, it's not going to digest as well. And then so those fatty foods are going to move through the body and then come out as a greasy, oily stool. And then some treatments for chronic pancreatitis. There's not, like I said, it's not curable, but there is stuff that you can do to manage it. So you would typically have a hospital stay, again, for IV fluids, medications, nutritional support, and then some long-term support that you would need would be a lower fat diet, because as I just mentioned, without the pancreas, digesting fats is much more difficult for the body to do. You would also have medications for pain and blood sugar management. Some ways to diagnose pancreatitis is you would have like a head-to-toe assessment by a physician, and then you would also get blood tests and stool samples done. The blood tests, there's stuff like pancreatic amylase and pancreatic lipase, which generally would be elevated if your pancreas was inflamed. And then the stool samples as well, again, to test for the more oily, greasy stools. And then you could even possibly need an MRI or a CT, X-ray, and other imaging done like that. And that's how it's usually diagnosed. And then some preventions for pancreatitis is to not drink or smoke, as those are risk factors. To live a healthy lifestyle, have a healthier diet, try to lower your risks for obesity and things like that.